So I would like to invite Dr. Valerie Lippitz up, and she is going to introduce our speakers for today.
Well, it's really wonderful being able to introduce my good buddies. And the fact that this is Boulder Community Health's 100th anniversary, as you guys know, most of you know, that I grew up in Boulder, and my first experience at Boulder Community Health was 1963, when I had my tonsils out. It's not quite 100 years, but it sure feels like it. So, our first guest is Rob Vissers, and he came to Boulder Community and became president and CEO in 2014. Prior to that, he held several leadership roles at Legacy Health, which is a nonprofit health system based in Portland, Oregon. And he was also president and CEO of the Northwest Acute Care Specialists, which is one of the largest independent physician groups in the Pacific Northwest. Dr. Vissers is a lifelong learner and educator who excels at creating efficiency and innovation to drive positive outcomes for his community. He completed his undergraduate studies and medical degree at the University of Western Ontario, and followed by a residency in emergency medicine at the University of British Columbia. He earned his MBA from Oregon Health Sciences University, Portland, and Portland State University. Dr. Vissers is well published and has guest lectured internationally. He's also been on the faculty at Harvard University, the University of North Carolina, and the Oregon Health Sciences University. He's currently a faculty member for the University of Colorado Healthcare Executive MBA program, and he's contributed to many local and national organizations. He currently serves on the boards of the Colorado Hospital Association, the Boulder County Business Hall of Fame, and Bridge House, which I hope you all know is this wonderful nonprofit that tries to bring people and lift them up out of homelessness. Our other speaker is Grant Besser. Grant has served as the president of the BCH Foundation since October of 2016. He became vice president of public affairs in 2018. Previously, he had served as a chief marketing officer for Teach for America and held senior management positions at Warner Brothers and Yahoo. Woohoo, okay. As BCH Foundation president, Grant is responsible for managing the foundation grants program, donor relations, and spearheading all fundraising efforts. That includes Boulder Community Health's $8 million capital campaign to expand mental health services in our community. And I'd like to welcome Dr. Visser and Grant Besser.
Thank you so much, Valerie. It's great to be introduced by one of your bosses. I have several here, Daryl, and I think I see a few others in the audience as well. But it's a real honor and privilege to be here today. Whenever I hear that lengthy introduction, I look at that picture, the one that was up there, I think I need to find something a lot shorter, and I need a picture where I don't look so serious. I need to find where I'm smiling. So maybe we can go to the slides. Maybe I might step here. Yeah, because then I can see what slide is up. And while we're doing that, I think what I wanted to start with, and I think the reason, or at least the premise for the invitation, is we're celebrating 100 years this year. So very exciting, 100 years to be an integral part of this amazing community. And my understanding is that makes us almost as old as the Boulder Rotary, right? Is it 101 years for you all? All right, so you're our senior, but still an incredibly exciting time for us and a great deal to be proud of. And in fact, we are, as you may be aware, a nonprofit, independent health system. And that makes us pretty unique, one of just a couple left in the state and not that many left in the country. So we're not part of a large system, we're not part of a for-profit system, our headquarters isn't based way out of town or in a different state. We're here, Everything that we do and the care that we provide and our providers and our health system is all within Boulder County and the surrounding area, and that has been the case for 100 years, and I hope remains that way for the next 100. And we do have a great deal to be proud of. Maybe we can go to the next slide. And I can tell a little bit of the story of how we began 100 years ago. So, School of Medicine used to be here in Boulder. And similar to a trend across the country, they said, we need to move the trainees to where the population is. So they made a decision, the university, to move the School of Medicine to Denver, and they were going to do this in 1922. Now, the community got together, and a group of the docs and others, and said, we can't really do without a hospital. So they worked out a deal where they were able to keep that facility for 2 more years while they built a hospital on Broadway, where the old campus is. And that opened in 24. But the Boulder Community Hospital at the time, and what became Boulder Community Health, that nonprofit, community-owned, community-started, community-focused organization, began then in 1922. And it really was from and built by and remains owned by the community of Boulder. So it's an incredible, proud legacy. My guess is that there was a Rotary Club meeting in 2021 and said, did you hear what's happening to the hospital? And it was a conversation there that probably started. I don't know if that's the true story, but that's the one I'm willing to tell. But regardless, it was similar to all of you. It was a group of people that were committed to the health and the well-being and the future of the community that they lived in and their families lived in. So a wonderful story and an incredible story of growth. And it's amazing for me to think about where we are today. And in fact, even just since I've joined the organization 8 years ago, the amount of growth and change that we've seen. One of my first jobs was relocating our care and everything we do over to the main campus in Foothills, just down the road, actually. Next slide, please. You've probably tired of the many lists telling everybody else in the country how great we are, and then so they all come here. But we do have a great deal to be proud of. And when you look at these things that call us the happiest place on earth, or the healthiest city, or the fittest city, or whatever, almost all of these measures include some component of health, wellness, safety, and health care, and access to that. And we're proud to be an integral part of what makes this community so great and so special and so recognized. Maybe we can move to the next slide. A number of years ago, I sat down with the board shortly after I got here, and we had a vision statement, and I can't remember it because it was about a page long. And we said, well, at the very least, we need a shorter one, but we probably need one that everybody can recognize and recite and list and actually work towards a true vision. And so we came up with this: partnering to create and care for the healthiest community in the nation. So as part of a community that aspires to be the best, we also aspire to be the best. It's what this community deserves. It's what it's worked towards. And it's a big part of all those other accolades. I also believe it's absolutely achievable. And when we do that, it's not just for this community, but we serve as a model for other communities, because I can tell you the entire nation is struggling to get this right. Healthcare is a challenge. It's complex. It's costly. And things are going to have to change in order for us to continue to improve and provide the great care that we do in this country. So we aspire to be a leader, not just to be a survivor. And really the way we're able to do that 100% is through our partnership with the community. And through our partnership with the community, through our aspiration to this vision, I think an important part to recognize, and we can go to the next slide, is that earlier thing I talked to you about, is that we're an independent health system, again, making us very unique. And it's really made possible, I believe, because of the independence. And when I talk about independence to my board and my team and groups such as yourself, it's not isolation at all. And if you recall, the vision we put up there started with the word partnering. We recognized for us to be the best, it means that we have to partner with those that do things the best. And whether it's our community organizations to support us through growth or challenging times like we've just had, maybe it's partnering with other nonprofits like Bridge House to address the homeless problem and the access to care that they struggle with. Or maybe it's partnering with other healthcare organizations where they do something better and we want to bring it to Boulder and bring the care local. But it's really through our independence has allowed us to do this. And there's a number of examples, I think, where we've really been able to thrive. It isn't without challenges, but what it does is it really gives us that agility, that responsiveness, that nimbleness to react and to lead, and also to do some things that other systems never could that directly impact the health and well-being of the community. There's probably no better example, I think, of the importance of this and our ability to respond because we're independent than the pandemic. And I know we're all tired of hearing about the pandemic, so I'm not even going to call it, it's an endemic now, all right? And we're doing well, by the way. I think this morning we had 3 people in the hospital with it. We were down to 1 the other day. I have more people, certainly with cardiac disease, orthopedic illness, et cetera, over 100 people in the hospital. It's a small percentage now, as opposed to at one point where it was a really big percentage. So we are managing through this like any other disease, and we have a lot to be proud of as a nation, but particularly as a community. But when I look back at those 2 years, I can honestly say those were the most challenging 2 years of my career for a number of reasons. I can also say those are the 2 years that I was most proud of any organization I've ever belonged to. BCH's response to the demand and the need and the crisis was nothing short of miraculous. Every single provider stepped up. The ability to provide high-level care to every single individual that needed it. The ability to retain and support our staff at times when our volumes plummeted dramatically. We were looking at a 40 million loss for the year, which we did not have because of everybody chipping in and sacrificing and making sure we got through it. Just at the very least, I bet most of you in this room experienced our vaccine clinic, otherwise described as the happiest place on earth at the time. It was done so well. So we're one of 5 hospitals in Boulder County. We were responsible for the vast majority of vaccinations within Boulder County. And that was through working very hard not only to get the vaccine, but make sure we got it into people's arms as quickly as possible. And that probably alone saved more lives than anything we did that year or the years to come. So a proud moment for us, and I am absolutely convinced that we would not have had the incredible infectious disease expertise and the commitment of the providers and the commitment to care and the outcomes we had if we were not an independent, community-owned, community-based nonprofit health system. Absolutely convinced of that. The other thing that really became manifest during that time, or apparent, is how critical the community was to our success. And you have supported us many ways, financially, through letters and comments of support. But during that time, just the emotional support and the outreach and the words of kindness and the recognition, we would not have been able to get through that time without that. It was overwhelming. It was truly amazing, and it really brought us together with the community, and again, I think made us realize the value that we bring, and that we're able to achieve what all of us that went into healthcare were striving for, which is to make a difference and to give back to the community that we live in and serve. So it was an amazing, wonderful time, and I have to say that we've come out of it a stronger organization, and we have patient experience or satisfaction scores now that are in the top decile of the nation. And we've always wanted to get there, and we have a pretty discriminating group of people that we take care of, by the way, and we're higher than we've ever been. Our quality scores have gotten higher. You would think that it would be more challenging with everything that we've gone through. CMS, which is the Center for Medicaid and Medicare Services, just listed us as one of the top, a 5-star hospital, which is the highest you can achieve, one of the top hospitals in the nation for quality and safety. And that should be reassuring for those of you that are approaching or to participate in Medicare. And so we have a great deal to be proud of, and I think we learned a lot from that time, and if anything, we've gotten better. And what we're hoping to do is continue to do what we've always done, to grow, to continue to bring amazing care and service lines to you all, to remain viable and independent. And it's not without challenges by any means, and there's some things that we really struggle with because we don't have the size and the scale. But we are also very aggressive about pursuing thoughtful partnerships to make up those scale in the places we don't have, so that we can really focus on what we need to do every day, which is providing high quality, incredible patient care and patient experience every day to our community. So thank you for taking the time to hear us and celebrate our 100 years together. I'm going to pass the mic over to Grant, who is going to talk a little bit about our foundation, which really helps facilitate the ability of the community to support us and us to support the community.
Good afternoon, everybody. It's really good to be here. I'm going to keep this short because I know we really want to answer questions here today. So I think I'm going to leave the slides and maybe we'll go forward on them, but right now we'll just pause on that. I wanted to start just for a few minutes of saying just thank you for the investment that you made in mental health back in 2019. If you remember, we were standing in what became the Mindfulness Garden, right, that you were the sponsor of, right outside of the Del Cabo Pavilion in fall of 2019. And that was a point where BCH and the board of directors and backing of the foundation decided that we needed to further invest and expand the services that we provide the community around behavioral health. At that time, we had no idea, what was about to happen, starting in March of 2020 as it relates to the pandemic and all the rising rates of mental health disorders and anxiety and depression and suicidal ideation and suicide attempts. You've all seen it. You've all felt it. And I guess I actually stopped by the Mindfulness Garden this morning as I was thinking about today. And because you walk out there, and there's probably a few new members in here who have never seen it, I really encourage you to come check it out because it's a pretty special place. The garden is really matured. At any point in time, you can find a patient or a family member kind of wandering through. If you remember, we worked with you to pick a number of different quotes that we etched into all the benches throughout the space. But it just shows the importance of the community behind our work. As we're celebrating the 100th anniversary, we're also stepping back at the foundation and asking the question of how can we best support BCH as we enter the next decade? And what does that look like? Historically, the last 20 years has been so focused on infrastructure, on capital, right? We moved from Broadway to the foothills, between Del Cabo Pavilion, the Anderson Cardiology Unit, the Tebow Oncology Unit, the Reynolds Building, so on and so forth. We're at a point now where infrastructure-wise, we're pretty good. So we're asking the question from a programmatic point of view, where can we be of the greatest value to BCH achieving its priorities? And just quickly, it really all comes down to access. The number one priority we've been working on this past year has been on our greatest asset at BCH, our greatest asset at BCH, our people. It's our staff and physicians. And they are coming out of the pandemic pretty exhausted. They are still incredibly mission-oriented, but we really need to look at how do we invest in them. So we received a really generous donation from a community member to build out a resiliency program, thinking through both from national models as well as local models, what are we putting in place to really build their resiliency? We also implemented a pretty incredible program that was a gift from Dave and Suzanne Hoover that created the Hoover Family Center for Education Excellence. And that's all about investing in their continued development. So we have tripled our budget that we spend every year in education around tuition reimbursement. So a nurse who wants to become a nurse practitioner, a medical assistant who wants to become a nurse, somebody who wants to get new certification, all the credits that they have to do every year that often were coming out of their pocket. So that's one part of access. The second part of access is behavioral health. So now that we have this incredible medical pavilion, what are we doing to ensure we also have programmatic excellence? So whether you're seeing your primary care physician and are in need of seeing a social worker, or whether you're in crisis and need inpatient care, what are we doing along the continuum to invest in you? And thirdly, what are we doing around comprehensive care for our community, especially those that are most vulnerable? So, whether it's our homeless initiatives that we're doing with Bridge House and Boulder Shelter, our community collaboration across a number of organizations that intersect with various social determinants of health, nutrition, aging in place, isolation, navigation, a number of different partnerships we're doing behind that, as well as this comprehensive care that we're providing. I'm going to stop because I think we have about 10 minutes. Is that fair, Valerie? Or we're okay, perfect. So maybe if Rob could come back up, we'd just love to answer any questions that you have today. Hear from you.
Thank you. A great talk and great work you've done. I've noticed just since I came to this community in 2011 that the cooperation between you and some of the other health systems has just gotten tighter. You have a common portal now where you can get it information. So congratulations on that. My question really concerns the monkeypox discussion, and not so much how dangerous or serious it might be, but I understand there are news reports that a number of medical professionals are actually refusing to treat people who have monkeypox. Do you have any idea what might be causing that? I mean, it's just another disease.
I don't know. I haven't heard that particular report, and I certainly haven't heard anything like that occurring in our area. As you know, it's a disease that's mostly transmitted through direct contact and extensive direct contact. So I can't imagine why. Now, it is associated with a certain demographic that sometimes it represents many demographics that unfortunately don't have access to care or are discriminated against. I would hate to think that that's why, but perhaps that's so. I guess all I can say is that I can't think of any provider in my organization that wouldn't provide great care to someone that presented with that or any other disease. I don't know. Yeah, please.
This isn't necessarily answer your question, but I think COVID is a good corollary, right? COVID, we have 4 infectious disease physicians at BCH. We were incredibly fortunate to head into a pandemic with that, asset. COVID required every single person at BCH, that's clinical facing, to take a different level of protective measures than they ever had to. And they've been doing that now for 2.5 years. So I think in a lot of ways, there's just our staff as a whole have become accustomed to adjusting to whatever that need is. It's not always easy, and I think there's a lot of exhaustion related to the pandemic around it. But I agree. I hope that our staff would always be out there. So if you are hearing anything specific, please don't be shy to share that.
Oh, sorry.
Thanks for coming to speak with us today. There was a story in the New York Times today about the posting of costs for medical services. Obviously, it's a huge issue in our country where so many people get to bankruptcy because of medical bills. And the story seemed to indicate that only 14% of the hospitals that they looked at had actually complied with the new regulations about posting costs. I'm wondering sort of, 1, how that's going for BCH, and 2, whether you all, from that side of things, believe that it will actually have any positive impact on pricing.
We're about to post a much more detailed listing of all our prices, and the answer is no. I don't think it'll make one bit of difference. It's a completely. I understand the thought behind it. I want to buy a car. Y'all show me how much this car costs, and I'll buy the one that costs the least if it makes sense for me to get it from you. Healthcare is complex, and unfortunately also, we have a billing system and a payment model that makes absolutely zero sense, filled with all kinds of the wrong incentives to drive the wrong kind of behaviors. And this goes back decades. And it's going to be difficult to unwind. What I do believe is that the more we can empower consumers to be able to make thoughtful choices about the care that they seek and the care that they receive, the better off our health system will be. And so I absolutely believe that an informed consumer and accountability are some of the keys to this. You need to know how we perform against others. You need to know actually that you have a health system here that does really great care, and that most people walk out of there saying, I felt like I was treated very well and I was cared for. But it's incredibly hard to measure those things. And so also that's the other problem with healthcare. You know, you get a cheaper car and maybe it breaks down sooner than you didn't like. That's a drag. You get maybe a little bit of a cheaper joint replacement, but it gets infected and you're never able to walk again. That's more than a drag. So the other part they're missing is the quality care component. But having said all of that, because of the broken reimbursement model, those numbers you see, nobody pays that. Nobody pays that dollar. So we post we have these sort of things that are sort of negotiated with the payers, and then the payers say, well, I'm going to pay you 30% of that, or I'll pay you 20% of that. And I can tell you that Medicare pays about 80% of the cost of what it costs to actually take care of someone per dollar, and Medicaid, it's less than half. And so unfortunately, those with insurance end up having to pay more to cover the cost for the others. And then it all has to do with whatever your plan is and what they've negotiated. And then even if we were able to tell you exactly what you would pay under your plan for you as an individual, then it has to do with, well, what do you have left on your deductible? And will the insurance deny it anyways, despite what they show? So the short answer is, I don't think this is the path towards the transparency and accountability that we need to empower the consumers to make sure that we're doing better. The one thing I will leave you with when we talk about costs of care, on average we get about a 1% to 2% more increase from Medicare and Medicaid each year. From our payers, maybe 3 or 4%. Some parts of the country don't get anything. And so the payers are maybe giving us an extra 3 or 4% a year. Think about how much they're charging you more every year, the payers. Our margin is about 1.5%. So we take all the money that we have and we reinvest it in the community and our care. Think about the margins that some of these private payers are making, 20%, 25%, which doesn't go to any care. And so you got me a little bit on a platform, but if we're looking for where money's spent in healthcare, are those dollars going to the people that need it to get the care, especially when we're running out of money? And when a quarter of the dollars are going to line the profit margins of these profitable payers, health insurers, then I think the system is a little bit broken. So definitely some transparency and accountability on that side would be welcome as well. Thanks.
We have a question online. I believe Nancy Chin Wagner's there.
Hi, Robert, and hi, Grant. I'm probably big on the screen. We've met before many times. And so I'm in Las Vegas, Nevada. And so the question, and you guys have been great, and your doctors have been great there for my husband. So thank you very much. My question to you is, what makes Boulder and the community so healthy that we are, like, you got the 5 stars for hospitality and qualifying for safety too. So what makes our Boulderites here so healthy?
Well, I'll let Grant elaborate, but my short answer is easy. I think it's the people. It's the people that work at BCH, and it's the people that are our patients. I mean, they're amazing. But Grant, I'll let you.
Yeah, I think if you think of our vision, partnering to create and care for the healthiest community in the nation, that's assuming that we're not yet the healthiest community in the nation. So we are incredibly fortunate to have a very healthy population that overall that does have the privilege and the access to great health care. There's a lot more we need to do as a community that I think has become even more clear in recent years, that there is a lot of challenges that exist, and there are a lot of challenges that exist around housing, around nutrition, around a lot of things that lead to health or not. So I think it's a double-edged sword. We have a tale of two stories going on in our community right now. We are continuing to push on our end to figure out how we can really truly say at the end of the day, we are providing comprehensive care for everyone in our community. There's a lot we're doing. There's a lot more work we have to do on that. So.
Great. I think we have one last question.
Thank you very much for all the information. I was wondering if you would comment on how fortunate we are with the medical staff that you have here in the community, the breadth of talent that we have, and the numbers, the ratio of population to physicians, and any other comment you'd like to make about the medical staff.
Well, thank you for that opportunity, because you're right. And that goes back to the prior question. You enjoy a quality of expertise and knowledge and providers, and I extend that beyond the docs. I extend that to the advanced practitioners and to the nursing staff and the techs, and in fact anybody who's part of that huge team that's at the bedside taking care of our population, or in the clinic or wherever. When I came here 8 years ago, I was taken aback at the level of expertise and the depth and breadth of the providers. And I've worked in big academic centers. I only worked in level 1 trauma centers, inner city places, and usually academic places. We were first in the state to bring robotic joint replacement and Mako, and we continue to be a leader in that place. We were the first, or one of the first, and continue to be a leader with the recruitment of a guy named Dr. Dan O'Hare. He's one of the world leaders on robotic open heart surgery. So instead of being open, they do it through a tiny slit in your chest, and you do better and you get out of hospital quicker. And I got a call from Portland from someone saying, hey, I was reading and I heard about this guy who's down in Boulder. Really? He's in Boulder? I'm going to come and get my surgery there. So we are, in some cases, a regional and national leader in places you would never expect a community hospital to do. We have actually four highly qualified infectious disease docs just at our community hospital. There are many large systems that don't have any, not systems, but hospitals, and incredibly bright, talented, committed people. So we have no problem, and again, this ain't a bad place to live. I mean, it's not hard to attract docs here, but it's an expensive place to live too. And at the end of the day, they don't come here because it's so great to live, and maybe because they think they can afford it. But it's because when they get here, they realize they also get to work in that environment of high quality care. And when you're in that place and you're not cutting it, you don't end up making it either. So I walked into an environment that enjoyed a long history of very high quality physicians and providers that I'm proud to be, including Dr. Warren, who's been one of the medical leaders in the community for a very long time. And Valerie, of course.
Before we close, I'd like to add one shout out to a longtime Boulder Rotary member, Daryl Brown. I mean, when you think about the investments that we make at BCH each day, whether it's the establishment of our Foothills campus and building it out, to the investment in new technology, to the exploration of new partnerships, Daryl Brown is on every one of those calls and leading many of them. So he's been a big part of that over time.
Well, thank you, Grant, and Dr. Rob Vissers and Grant Besser. It's our club's tradition that, despite you being my bosses, is that Boulder Rotary gets the last word here. Okay, and so it's my honor to respond to you. Thank you for coming here today, sharing just a bit of the story of Boulder Community Health with us. It's been my pleasure actually to serve at Boulder Community Health for almost a quarter century now. I don't look it, I know. And it really is my pleasure to serve with both of you alongside of you now. As you've relayed, local health care is incredibly important to this community. Local governance is the best way to provide for the needs of Boulder, okay? And I'm convinced of that, and that's what we do at Boulder Community Health. I want to remind people that at the the Museum of Boulder is going to have an exhibit about our 100 years starting August 18th. So it's an in-depth dive into the long and illustrious history. And so Rob and Grant, as you're probably aware, Rotary's been leading the fight for global eradication of polio. And we've been doing this for 35 years, and as we like to say, we're this close to making it happen. So in your honor today, we're going to donate 100 doses of polio vaccine to the fight, and it's a very fitting tribute, I think, to two leaders in healthcare. And so really, thank you very much for being here today, and thank you very much for what you and for what BCH does for our community.
Thank you.